Hello guys, welcome back to my channel which is Real Homeopathy. Please like, share and subscribe to my channel and stay tuned for more updates. And weekly I'll be uploading 2 videos on gynecology which will be helpful, and I'll be saying everything in detail and brief, and I'll be saying which is important and which is not. And today I'll be explaining you mainly on the ovarian factors, which is a polycystic ovarian syndrome. And I have said you in the previous class that I'll be explaining in the next class about the PCOS and the willebrand disease. So today in this class I'll be explaining about the polycystic ovarian syndrome in detail. So let's begin. So PCOD, so polycystic ovarian disease or syndrome it is also called, and it is most commonly seen nowadays in every woman actually. So syndrome means where two or more symptoms is involved. So this is the most common endocrine disorder in a woman of reproductive age. So the young reproductive age women will usually suffer from this PCOS, and it usually consists of 3 factors, which are amenorrhea, hirsutism and obesity, which is associated with enlarged polycystic ovaries. So the main etiology or the main cause of this is it is characterized by excessive androgen production by the ovaries. So there is increase in the production of this androgen. So this PCOS again, it is a multifactorial and polygenic condition. So next, coming to the diagnosis of this. So how you diagnose when a person is undergoing in a PCOD condition. So we see here there are certain criteria which you need to follow. So there are certain diagnostic factors, which is oligo and or on ovulation which happens. Next one is hyperandrogenism, which is clinical and or biochemical. Thirdly, you will see there is a polycystic ovaries. Polycystic ovaries. And nextly, you will see other etiologies such as congenital adrenal hyperplasia, CAH, and you'll see thyroid dysfunction, and lastly you will see hyperprolactemia. Hyperprolactemia, which is also known as Cushing syndrome. So these are the diagnostic factors which you have to consider. So the incidence of this PCOS varies between 0.5 to 4%, which is more common amongst infertile women. So next, coming to the clinical features of this PCOS. So there are certain clinical factors which you need to consider here. So the patient usually complains of increasing obesity, that is which over the abdominal. So you see that about 50% the accumulation of fat or obesity in the abdomen. Second one is menstrual abnormalities, which is about 70% in the form of oligomenorrhea, amenorrhea, or dysfunctional uterine bleeding. So these are the menstrual abnormalities which is of 70%, which is in the form of oligomenorrhea, amenorrhea or dysfunctional uterine bleeding, which is DUB. And lastly, you will see that is infertility. Next clinical feature you will see is presence of hirsutism. Hirsutism and acne. Okay. So these are the above mentioned clinical factors of this PCOS. Next, coming to the pathology of the PCOS. Okay, typically, so here when you consider the pathology of the ovary, so you basically should know there are certain cysts which are present on both of the ovaries, which is bilateral. So the ovaries are enlarged here. So the volume of the ovary, it is increased, which is more or less 10 centimeter. So there is trauma is also increased, and there is a capsule which is thickened and it is pearly white in color. So there is a presence of multiple follicular cyst which measures about 2 to 9 mm in diameter and are crowded around the cortex. Nextly, you will see the main viva was question, and also may or may not ask for theory, which is acanthosis nigricans, but it is a must know question for viva. So this is characterized by specific skin changes due to insulin resistance. So the acanthosis nigricans, if you hear the name, you should think of the skin. So here basically the skin gets thickened and pigmented. The skin becomes thickened and pigmented. So the color which it changes is to grey brown in color. So the PCOS means it is caused mainly from hyperandrogenism, insulin resistance, and acanthosis nigricans. So nextly we will see the skin is commonly this common affected sites of this skin is like it is in the nape of neck, and you'll see in the inner thighs and grayon and in axilla. So these are the pigmented sites. Nextly we will know about the investigations, what you have to do once you have to confirm. So there are 3 investigations which you have to do, which is a sonography. So the sonography, in that you will see transvaginal sonography you have to do, which is specifically useful in obese patient. So here you see ovaries are enlarged in volume, and also there are number of cysts that have been formed. So that you will be seeing in the sonography, and it is mainly seen, or it is mainly useful in obese patients. Ovaries are enlarged. Nextly you will see first one was sonography and the second one will be the serum value. In serum value you will see there is LH level is elevated. So luteinizing hormone levels will be elevated, and or the ratio of this luteinizing hormone and follicle stimulating hormone will be more than 2:1. Next, raised level of estradiol and estrone. So here the estrone level is more elevated than estradiol, but both of them are increased. Nextly, you'll see SHBG. So SHBG stands for sex hormone binding globulin. So this level is reduced here. Next you see hyperandrogenism, mainly from the ovary but less from adrenals. Androstenedione is raised. Next, serum testosterone is raised, and insulin resistance. Raised fasting insulin levels, which is more than 25, and fasting glucose or insulin ratio response will be more than 300 at 2 hours. And last investigation will be laparoscopy. So in laparoscopy you will see there is a bilateral polycystic ovaries. Okay, so this is all about the PCOD, which is a polycystic ovary syndrome or polycystic ovary disease. So these are the things you have to write. Next question will be von Willebrand disease. So von Willebrand disease is a lifelong bleeding disorder in which your blood doesn't clot well. People with the disease have low levels of von Willebrand factor, that is a protein that helps blood clot, or the protein doesn't perform as it should. So then a person will get this von Willebrand disease. So this question will be particularly asked for 3 or 5 marks, that's it. And it is a desirable to know question, which is like whether they will ask or not ask. Nice to know, desirable to must know. So this is like 50-50%. Either for Viva, either for theory. So this is a lifelong bleeding disorder. So most people with the disease are born with it, having inherited it from one or both of the parents. So there is more bleeding. So this is an inheritary disorder. Next, it can't be cured, but there is a treatment. Symptoms of this von Willebrand disease. So symptoms of this will be, there are 3 main types of the disease. The amount of bleeding varies from one person to another depending on the type and severity of the disease. So many of them don't know it because the signs are mild or sometimes it is absent. The most common signs of the condition is abnormal bleeding here. So you have to consider the certain symptoms which I am going to say you. There is an excessive bleeding first of all from an injury or after surgery or after dental work. Second one, there will be nosebleeds, which is also known as epistaxis. Thirdly, heavy or long menstrual bleeding. And there is hematuria or melena, which is blood in the stool or the blood in the urine. Hematuria or melena. Next, coming to easy bruising. So there is easy bruising, or sometimes whenever there is a bruise or injury, so there will be a formation of some lump. So this is easy bruising or lumpy bruises. There are even some menstrual symptoms. Symptoms of anemia includes like tiredness, fatigue and shortness of breath. Nextly, blood clots in menses. So even you will see there are blood clots in the menstruation. So the main cause of this I will be seeing you is, the cause of this is an inherited abnormal gene that controls von Willebrand factor. So this is an inherited disorder which is not acquired. There is a protein that plays a key role in blood clotting here. So when you have that low levels of that protein, so there are some blood cells called platelets. So these will be like very less in number. So the risk factors you see here is autosomal dominant inherited disorder, which means you need an abnormal gene from only one parent to be affected. Complications of this. So there is decrease in level of factor 8, and also you will see there is a hemophilia factor 8 in the levels. Even you will be seeing it in hemophilia. Next, coming to the complications of this von Willebrand disease. So rarely von Willebrand disease can cause uncontrollable bleeding, which can be life-threatening. So there are certain other complications, which is anemia, and also there is swelling and pain. Okay, so this is all about the von Willebrand disease. So this will be asked for three marks, that's it, or 5 marks. So please do like, share and subscribe and stay tuned. Thank you.